The Hovermatt is an air patient transfer device. Step-by-step instructions are quick and easy to follow. If the Hovermatt is not already in the bed or stretcher, place the Hovermatt mattress underneath your patient using the log rolling technique and attach the patient safety straps. Whatever your patient is lying on to keep the bed mattress clean can be placed on top of the transfer pad to help keep it clean. Plug the electric cord into a nearby outlet. Attach the flexible hose to the end of the mattress, parallel to the foot end, and snap in place. Be sure that the transfer surfaces are as close as possible and break the wheels. If possible, transfer from a higher surface to a lower surface. Turn on the air supply. Grasp the handles and pull your patient on an angle, either head first or feet first, until your patient is in the desired location. If the width of the equipment receiving your patient is less than the width of the transfer pad, ensure that your patient is centered on the receiving equipment prior to deflation. Once transferred to the receiving surface, turn off the air supply and allow the Hovermatt to deflate. Your patient has been moved effortlessly. Injury to the caregiver has been prevented. Your patient is safe and comfortable. Skin shearing, bumping, and bruising have been prevented. Use of the Hovermatt for transfers often decreases bleeding following certain procedures, and for some patients, it also decreases the pain that can be experienced during movement. Safety hints for caregivers using the Hovermatt. Hovertech International is able to provide handle extensions at the request of its customer. However, as you can see demonstrated, Hovertech feels that these extensions can be a safety concern and suggests that they be used with caution. Even though the Hovermatt transfer is effortless, a two-person transfer is recommended to assure that your patient is not over-transferred. Use the side rails to prevent an accident of this nature as well. When transferring your patient, it is not necessary to lean across the receiving surface to grab the Hovermatt handles. Your partner can begin by pushing the mattress towards you. You can then grab the handles without risking your back. Make sure you lock all wheels before initiating the transfer. The Hovermatt can be installed in individual departments in the hospital or on a patient-dedicated basis. The Hovermatt can remain deflated under the patient who requires assistance in moving themselves. This way, there is a certainty that the caregiver will use the safety equipment when it is needed. You can use the Hovermatt in all areas of the hospital. Simply go to the easy-to-use chapter feature at the beginning of this video to see the Hovermatt in action in many different departments. These chapters will also reveal other equipment and accessories.